Hello and welcome to this edition of Doc Talks. I'm Dr. Don Selby, a naturopathic physician practicing at Copper Valley Medical in Chandler, Arizona. Our topic today is strep throat, better known as strep pharyngitis. Pharyngitis means a pain in the throat, particularly at the back of the throat, and this pain may be increased with swallowing. In addition to the pain, the patient may experience excessive redness at the back of the throat, known as the posterior oropharynx, hoarseness, headache, a runny nose, or cough. Strep throat, a particular type of pharyngitis, again, streptococcal pharyngitis, is caused by bacteria such as Streptococcus pyogenes. Strep pyogenes is in a group of bacteria that react the same way when placed on a specific type of culture media in a lab. They are called Group A beta hemolytic strep because the space around the organism on the plate will be clear. On this slide, you can see the clear zone around a plated organism. That's Group A beta hemolytic strep. Most of the time, a sore throat is not caused by a Group A beta hemolytic strep. In fact, only about 10% of the time is it caused by a bacterial agent. The rest of the time, a sore throat is caused by something fun like rooting for your favorite sports team or a viral infection. Maybe 25% of sore throats in children are Group A beta hemolytic strep. To examine a patient for Group A beta hemolytic strep, and I'm also talking to you moms that like to look in the throat of your child, please be aware that looking at the throat alone is not a basis for making a diagnosis. You simply can't tell by looking at the throat. Further, there are times when you should not be looking at the throat because it could, in fact, induce an airway obstruction. There are certain signs and symptoms that will increase our suspicion that a sore throat is actually a streptococcal pharyngitis, particularly true in children. When a child or even an adult has a hoarseness that sounds like a hot potato voice, that is, it sounds like something hot is in the mouth, this could be strep throat. We are also concerned when there are swollen lymph nodes in the neck, there is either a fever or a history of fever, and when there is not a cough. That increases our index of suspicion for strep pharyngitis. A patient with streptococcal pharyngitis may show an exudate on the tonsils or at the posterior oropharynx, which is the back of the throat. Now, an exudate does not necessarily mean the patient has strep throat. It could be mononucleosis or even diphtheria. In addition, the tongue may have a strawberry appearance. Here is a picture of a patient with a strawberry tongue associated with strep pharyngitis. There are office-based rapid strep tests that can be used with patients. The indication for strep testing in adults is at least 2 of those common symptoms of fever or history of fever, the lack of cough, an exudate on the tonsils, and tender swollen lymph nodes. This is necessary. In children, if there is a history of pharyngitis and there is fever, exudate, tender swollen lymph nodes, and lack of cough, so even one symptom, it is necessary to do a strep test. Once the diagnosis of strep is confirmed, it is appropriate to prescribe a broad-spectrum antibiotic. Most commonly, we're going to prescribe amoxicillin and clavulanate. This is sometimes goes by the trade name of Augmentin. Antibiotics should not be given until or unless the strep is confirmed. If it is viral, and again, 90% of the time it is, antibiotics will not do any good and may harm the patient. Viral and other causes of pharyngitis, other than the group A beta hemolytic strep, usually only last for a few days. There will be pain, and that can be managed with a low dose of an NSAID, a nonsteroidal anti-inflammatory drug, such as Advil. My personal preference is the Advil liquid gel caps. Never, never, never take or give an aspirin to someone with a viral infection. In children, aspirin and viral infections have been linked to Reye's syndrome, which can be fatal. And in adults, I am convinced, perhaps I am alone on this, that it is linked to Guillain-Barré syndrome. Never, never, never take an aspirin with a viral infection. In addition to prescribing antibiotics for streptococcal pharyngitis, we recommend patients gargle with warm salt water for about 30 seconds several times a day to help relieve the pain. We can also swab the back of the throat with a 50-50 mixture of oil of orange and purified water. Streptococcal pharyngitis is not a sore throat to be ignored. This is not a condition to just see if you can outlast it. There are potentials for very serious complications. Among the potential complications of strep throat are scarlet fever, rheumatic fever, and post-streptococcal glomerular nephritis. Scarlet fever is the sore throat with a body rash that feels a little bit like sandpaper on the skin. We see it on the upper thorax, and it might be a little bit worse in the axillary or armpit area. Rheumatic fever is characterized by migratory pain in the joints, except for the hands and the feet. There may also be an endocarditis, an infection of an inflammation of the muscle of the heart, leading to a weakened heart. And there may also be a tick-like disease called Sydenham's chorea that leads to uncontrolled motor function. Post-streptococcal glomerular nephritis, which occurs about 2 weeks after the strep infection, is going to resolve spontaneously and no additional treatment is required. The most serious potential complication of streptococcal pharyngitis is respiratory distress, that is, a complete closure of the airways. If you have strep pharyngitis or you are caring for someone with strep pharyngitis, watch out for drooling, a bulge in the throat, or an extreme difficulty breathing that we call stridor. In young children, and especially newborns, this can lead to a retraction, that is, an indentation between the ribs, and that indicates that there is a respiratory medical emergency. Strep throat, streptococcal pharyngitis, can be prevented. It is transmitted person to person by means of nasal discharges. Therefore, effective hand washing is essential to help prevent the spread of this disease. All coughs and sneezes every day need to be covered. Sneezing into the crook of your arm is a fine way to prevent that from spreading. We recommend that you drink plenty of fluids and get adequate rest and sleep. The last one is to brush your teeth and floss on a daily basis. No, we've not turned into dentists, but let me explain this. Every morning after you brush your teeth and floss, gargle with an alcohol-based mouthwash. Gargle for about 30 seconds, really throwing your head back and letting that alcohol get to the back of your throat. Then, every evening before you go to bed, repeat the process, but gargle and rinse with hydrogen peroxide. Yes, your tongue will get foamy, and yes, there will be white foam on your teeth, and your mouth will dry out, but you will be killing off bacteria. This has been Doc Talks. I am Dr. Don Selby, practicing at Copper Valley Medical in Chandler, Arizona. Our phone number is 602-566-2015, 602-566-2015. If you'd like to send an email, our secure email is info@coppervalleymedical.net. Our website is coppervalleymedical.net. Thank you again for listening to Doc Talks.